Welcome back to Beyond the Plan. Today we're joined by Dr. Sandra Primiano from Dialogue. She's a psychologist and a strategic leader redefining digital mental health and modern EAPs with a focus on access, engagement, and real outcomes. Dialogue has partnered with MyHSA for a few years now to support employee mental health across Canada. I think it's a really important benefit, and I think anyone listening should consider adding it to their benefit plan. This was such an interesting and genuinely fun conversation for me, and Dr. Sandra was an equally fun guest to have on. I hope you enjoy it. So MyHSA has been a partner with Dialogue for a long time, but for those who are not familiar with Dialogue, can you describe what you do and what the platform does?
Yeah, absolutely. So what's really unique is it's truly the only integrated virtual health platform. So what I mean by that is everything is in one place. You access the app and you can connect to any services that you need, whether it's for physical health, mental health. It might be life services. What I mean by that, it could be financial, nutrition, support with career. So think about it as your primary care for your physical health, psychotherapy, counseling for mental health, and then those life services if you need support with legal, financial, career, which you would find in typical employee and family assistance programs. So it will bring that all in one place.
That's awesome. I know here we have lots of members of MyHSA that are using Dialogue, but even our coworkers here, we've heard lots of stories of them being in a pinch and needing to get help, and everybody here is a big fan of Dialogue, so that's awesome. I'm curious what drew you first to the world of psychology and then to Dialogue. Like, tell me a little bit about your career journey.
Interesting questions. I think I'm one of those rare people. When I was 12 years old, we did a time capsule in grade 6. And when we opened it, it said, I will be a psychologist living in Florida with a chameleon. So parts of that I got right. Parts of it I didn't follow. So all that to say, from a really young age, I was very interested in human behavior, people's personalities, friends. Why does that person do that? Why does that person react like that? And then beyond the curiosity of behavior and really psychological symptoms. When I look back on it, that's what it was. Whether it was, someone was very anxious and having a panic attack, any manifestation of mental health was very fascinating. And then of course wanting to help. What do you do after? If somebody's having a panic attack or is very anxious or stressed or has a plane phobia. So then that fascination, brought me forward to studying psychology. And I think it was when I was in college, it would be like the grade 12, 13 when I had my first intro to psych class. Wow, mind blown. And I just connected from there on, really.
That's really cool, and I actually I'm not as interested as you, obviously, because I didn't go for it as my career, but I'm always really interested in the same thing, human behavior, trying to understand mental health, and then tie in that part of your journey with Dialogue. Like, how did you get to Dialogue? What happened?
Yeah, dialogue is sort of a happy accident in a sense. I've been in sort of the employee and family assistance program world for well over a decade. I worked also for the government as well, and I was always in trauma treatment and anxiety disorder type of treatment world, and then EAP. And I worked at all of the big EAPs over the years. And and then I would ask myself, what's the future of EAP, employee and family assistance programs or EFAP programs? Where are we going with that, right? They've been around since the 70s. Majority of employers offer them, but what can we do that's different, that's innovative? And that's where dialogue comes in because dialogue has the ability to innovate and work really closely with clients to change services, build new ones, different flows, provide very quick access. So when I was looking at them from afar and I was thinking, how on earth do they offer an appointment in 24 hours? Like people can wait weeks for counseling, right? So is that ease of access and innovation. And then when I saw that there was an opportunity to create more in the EAP space, I thought, well, this is it. This is going to be the future of EAP and innovating those services. So I was very drawn to that. And then also them being Montreal based is the first time I've ever worked for a company, that's based where I am, which is really nice to have, that kind of presence as well.
Yeah, that totally makes sense. I love Montreal, by the way. I went there and I absolutely love Montreal. It's the most beautiful place in the world. The bagels are delicious. I know that's probably the most typical tourist thing to say, but The bagels here are not very good, and in Montreal, they're so good. You kind of piqued my interest when you were talking about, like, EAP and how it has, evolved over time from when they were, like, a new idea, and it got me kind of thinking about EAP because I've always had one, I think, even before my HSA at every employer, but it's never been something that I would think of as accessible. Like, even when I was, like, new to the workforce, I knew I had one, but I didn't know what it was or the accessibility of it, given that was a while ago now. But, I think it's really cool that Dialogue is making it more accessible. Because to your point, usually if someone's having anxiety, and especially if someone's in crisis, they don't have tons of time. Like, they don't time is, like, of the essence, so I think that's a really cool thing that you've eliminated that barrier to entry with
Yeah,
Dialogue.
absolutely. And then services being accessible virtually has made a huge difference. And that was, well, because of the pandemic, right? Everybody had to change the way we offered services. We had to make sure they were available virtually. And something that's so important with any mental health, any issues that we might be experiencing, obviously, there's so much stigma, right? So, stigma, I see it like, in a sense, it robs your courage to consult. And you may be struggling with an issue for weeks, for months. It takes a lot of courage to really open up and then decide to try to get help or resources, right? So then if you're ready for that and you have to wait weeks, so you lose the momentum. The waiting then makes you lose that momentum to consult. So that's why it's so important to be able to access care when you need it quickly. And of course, symptoms evolve and become more severe too. But for me, that's a huge game changer, and being able to connect wherever you want, however you want. If you want to engage with, a counselor, a person, or if you want to access resources on your own, it's very important to give people choice as well.
I totally agree. I think that, like, especially if it's someone who's thinking it for the first time, they've never spoken to a counselor or any professional before, and they are having a really hard time, or their relationships are suffering, or they don't know what's going on. And they're thinking maybe for the first time, I have the confidence and the courage to reach out. And then if there's like a time lapse to your point that, that person could suffer because they're not going to reach out. That momentum is so necessary. It's so important. That's a really good point. So it sounds like very, very important work that you're doing, not just in psychology, but with dialogue, because I think that is so important to make it accessible to everyone. And that's a good segue into kind of the theme of this podcast. We were going to talk about it being January. Everybody's holiday high has kind of worn off, and the bills are hitting, and back to work and back to school. Can you tell me a little bit about patterns that you see at this time of year?
Yeah, yeah, for sure. And I think a lot of it, the way we can see it is, the holidays is a period of overstimulation and disruption of routines, right? So you're out of your habits, you're out of your sleeping habits, eating habits, financial habits. There are different family dynamics, friend dynamics, from different events. So all of that is stressful. And it can be a good stress, it can be exciting. For some people, it can be a period of loneliness, so it might not be good stress. For people who have difficult family dynamics, it can also be extremely stressful to see, certain relatives or have interactions that don't make us feel really great. So you're in this period of sort of being more activated, your whole system. So when you come back to work or you go back to school and everything kind of settles down, your body is still reactive even though the context has shifted. So that's where you might see things like, sleep disruption. You might see people more irritable, more annoyed with things, that brain fog, trouble concentrating and getting back to, mental sharpness and focus. So I think the way I see that after period is because your body's still kind of alert, but things are slowing down, that there's like almost a numbness, a fogginess, a sense of detachment, more than anything. And then some people will carry stress from finances and different decisions that they made, or even consequences from relationship issues that have come up. There could be arguments or tensions in families and groups. So you're kind of carrying all of that. And then, Monday hits, whoop, and you're back to work, back to school, getting the kids organized and So it's a lot at once.
I totally agree. I think everyone that I have talked to since the holidays has said, even if they have a really great family dynamic, which isn't to your point, that's not everyone, but even people with best case scenario, they say it's too much drinking, too much socializing, bad diet, really easy to, sleep in every day and stay in your pajamas because it's dark out and it's snowing and like it's really disruptive. And then your finances and everything, and it's overconsumption. There's so much in the holidays that's awesome. It's such a great time for a lot of people. But on the flip side, I've been thinking about how it amplifies everything. It amplifies your spending, it amplifies your drinking, it amplifies people's bad habits, honestly. And I know for me, as soon as I got back to work, I was like, I need to eat like carrots. I need something like I need a vegetable and I need to drink some water. So I think that not only the mental side, but the physical side, everything is just totally disrupted at that time of year. Do you find that it affects men and women the same way, or do you find that like the strains show up in different ways?
I think the fact that we have different gender roles, in whichever way that might be, it's not always the same, right? In all settings. But if we're in, typical type of gender roles, women are going to carry a lot more stress and burden related to things like planning, relationships, parties, preparation, food, cooking, gathering gifts, buying gifts, wrapping gifts, getting the gifts to where they need to go, whether and outside of immediate family. But there's, if you have kids, there's people at the school, your kids bringing gifts in school and all. I think that, in traditional kind of gender roles, women will carry a lot more kind of burden and responsibility around organization, relationships, planning, especially at that time of year where there's just so much happening. And then men maybe more so financial, kind of burden and a stressor that might look a little bit different. So I think it can look different, definitely. And those kinds of stresses and feeling guilty about spending and money, finances. I think it can look different depending on people's roles for sure.
Yeah, yeah, I totally agree. I think when I talked to my network, a lot of the women were saying like it is kind of a beautiful role, but it's like magic making. You're the magic makers, but that's a huge responsibility. That's like way too big of a responsibility. And then I'm sure that the dynamics in a lot of relationships suffer because both people are under completely different stress and are waiting for the other person to kind of kick in and help. And then you did touch on loneliness. Not everyone's in a relationship or has a family dynamic around Christmas time or around the holidays. So, do you find that loneliness is something that comes up a lot at this time of year? And
I think it really depends, like you're saying, on your personal situation. If people, you may not be in a relationship, you may have fantastic friends, you may have, great relationships with family. So I think it really depends on if you're able to have those connections and like meaningful relationships, whatever they look like. Not everybody does, and because it's so amplified that time of year of whatever kind of messages that we see and hear about the holidays, you're going to feel it. You're going to feel it very differently depending on what your circumstances are. And then I think it trickles into January where you feel just a sense of detachment and almost like emotional numbing and like disconnect from others, and you might withdraw from others too because you might feel bitter or upset about circumstances and situations, or embarrassed that people talk about, whatever events or whatever their situation might be, and that you might not have the same, you maybe didn't have similar experiences and you're embarrassed to share that. So I think it's so personal. And because of the way all of these ideals get highlighted around these big holidays, there's a way you think you need to be. Right?
I think, yeah, definitely. I think social media and everything also makes that comparison is probably super amplified as well because I know when you come back to work, it's the beginning. Everyone's question is, "How are your holidays? What'd you get for Christmas? What did you do? Do you have any special family traditions? And what if you don't? What if you didn't do gifts? What if you don't have family traditions? What if your Christmas sucked?" It's like coming back to work is hard for people.
It is for sure. And sometimes you just don't know what to say and it's, you're back. So you say, "Oh, how was your time off? How was your time away?" And because it's a very normal thing to say. So you just don't know what people's situation is like and their practices and so that's why I say like your time off or without saying or I might say like holiday season without naming, celebrations or because you just don't know, right?
Yeah. So your role at Dialogue, you're in a director position and I'm an employer here. And so as kind of someone who's in leadership, when you see employees coming back from the holidays, do you have any advice for how employers can connect with their employees and make sure that they're feeling like they can come back to work and feel psychologically safe and things like that? Do you have advice?
Yeah, for sure. I think always having a culture. So, if we want to promote psychological safety, we want to have a culture where we talk about mental health and well being regularly. Not that not just because it's a special occasion or particular period of time, but we integrate that into our culture. It becomes commonplace to see someone and say, how are you doing? We haven't connected in a while. Do you have 5 minutes? And be able to ask those questions so that people feel a sense of trust, a sense of safety with you and that ability to have that kind of connection, or else people typically won't share anything real if there's no trust and safety. So we want to develop that. And to do that, we want to have those regular exchanges. We want to ask questions. And then I think something that I've seen people do really well when you're comfortable doing it is also showing vulnerability in those relationships. If people aren't open and don't share much, it can help to say, I was really sick over the break. It was pretty rough. I spent like 4 days in bed and you know what? I'm really tired today. To share something about yourself, to make you more human, to make you more vulnerable, and people tend to feel a greater sense of like safety and connection and are more likely to share. And when we share more, that's the only way we can help or try to help offer resources or detect if, someone isn't doing well because without that, we would have no way of knowing, and so I think, like we were saying, if we, make assumptions, or it will be more difficult to actually help and understand anything about somebody, if we say like, "Oh, you're back, I bet you had a great time," or "Was it just wonderful?" Or, we're not really gonna make it comfortable and safe for people to truly connect.
Yeah, I agree. I think when I connect with people after the holidays and they ask me how my holidays were, I was very careful to kind of, like you said, be vulnerable, be a little bit more relatable, even though, like, even if it was great, just saying, like, man, I'm pretty tired. I'm socially tired. I'm ready to get back to normalcy, things like that. Cause that kind of opens the door for them to say, yeah, I'm really tired too. Actually, my Christmas was really challenging, or something like that. Or they might say, oh, my Christmas was great. I don't want to be back at work, but I'm gonna buckle down anyways, and that way you give them that freedom to kind of go either way. I think it's important for us too to be able to open up as the, leadership. I think it's important to like focus on every different kind of person. And that's a good segue into the next part of this conversation is our listening base on this podcast is often advisors and brokers most of the time. And I think advisors and brokers are often focused on their clients and their clients' employees to make sure that everybody in that area is getting the care they need. But how do we turn the focus on advisors? Because they just got out of the busiest time of the year. This can be a lot of high pressure work for them. Do you see anything like that where like high level, high demand professionals are coming in and talking?
Yeah, definitely. So we have lots of clients like this. We that are in similar situations, and it relates a bit to what I spoke to previously. But when our body is in a sort of a continuous state of performance, of demand, of sort of emotional buffering, we don't we tend to maybe not pay close attention to what we're feeling, and we need to perform. We have to make quick decisions and keep going. We can sustain that for a period of time, right? But then when those deadlines are kind of over and some of that pressure releases, our internal system is still activated. It can't just, it takes time to kind of get back to a more regular balanced state. And so people often, when things settle down, often after a period of stress, maybe you get a cold. Well, if you think about it psychologically, after a period of stress, that's when you might feel more disconnected. You might feel more like emotional numbness or like kind of flatness, disconnect. You might feel irritable. You might feel less motivated, less connected to people, to work. So it's that period of transition, and then obviously you can feel a lot of fatigue and have trouble also cognitively concentrating. Um, so and then that can be followed by things like, not feeling as happy, not feeling as creative. And so I think we need to give ourselves time to readjust after a period of like great intensity. Give ourselves grace and see what we're capable of doing and when, without saying like, "Well, it's January 1st, so I'm gonna be doing this, 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 this." Like, what's actually realistic to sustain change or to get back into a routine? And it could be something very small, you know, over a week or over a day. We have to figure out what we're comfortable with to kind of get our system, more regulated and balanced and be in a more optimal state. And all of this is very, very normal, right? Like that's just the way our bodies and our minds are going to react to these kinds of periods of stress.
Isn't that funny that it's when we're the highest, like, stress in January is also when we're like, "We're gonna complete new year, new me. I'm gonna completely change my career. I'm gonna lock in. I'm gonna go to the gym. I'm gonna spend more money on, like, this." It's like we put way everyone is putting way too much pressure on themselves at this time of year, and everyone's, I think, not only looking at the next year and saying, "I want to lock in and I want to, get that promotion or achieve that goal." But then they're also looking at the past year going, "Oh, here's all the things I didn't do last year. Here's all the places I failed." I think that's, like, a common thing. Do you see burnout, like, in higher numbers at this time of year?
I think I think we see a lot of different things. Uh, I think this is a hard time psychologically in general. I think some of it's related to the weather too, is related to the change in light, to the fact that we're inside more often, we're less active, we see less people, socially. All of our resilience factors are different in the winter, in a Canadian winter. It does affect us. And I think that because we're coming out of a period of stress and it being a new year and different pressures that start up in the new year, new quarter, there are definitely periods where people are going to feel burnt out. Peaks, we do see peaks of things like depression, of burnout, of substance use, anxiety as well. So it's a hard time of year, realistically, even physically. There are big spikes in the flu, right? I'm sure over there there's been a lot of flu going around. So there's more illness, right? And then so that makes it more difficult for your system to recover as well, and for you to have an optimistic perspective when you're stuck in bed for 5 days. So there's a lot at this time of year for the next couple of months.
Yeah, it's like a compounding, like everything we've talked about from Christmas, the loneliness, going back to work, you know, physical things, getting sick. And then to your point, like Canadian winters are rough. I think that that's something that we can all admit. I'm driving on the way in like driving into work this morning. I'm thinking to myself, like, man, I can't wait to drive in when it's a light out. Like, I'm so tired of nighttime driving, just waking up in the dark, getting ready in the dark, saying goodbye to my husband and dogs in the dark, and then the sun just came up, like, this is brand new, and, I think that it's hard, like, I'm ready for spring already.
Yeah, definitely. It makes a huge difference. So I suppose when I look at that, I think, well, okay, how do we equip ourselves? Like any kind of muscle, right? The more you use it, the more you strengthen it. Well, to be resilient, we have to use those skills. And when we think about how to be resilient, well, we have to think of things like optimism. How do we practice optimism? How do we practice gratitude in really simple ways? How do we strengthen our relationships with people who matter? Because those are huge factors that are going to help us with our mindset, with our mood, with our level of energy or motivation. So knowing that this is a hard time of year, I think it's helpful to think of what are those resilience factors that help you. What are, what do you see as beneficial that you can do, even if it's small, very small things, like, thinking of one thing that we're grateful for.
Yeah. Yeah. Yeah, I love that. I think that I've learned last year kind of to practice that a little bit better. I saw a little trick, and you can tell me if this is a medically sound way to do it. But I saw this little trick where instead of saying something like, "Oh, I have to go to the doctor today," you say, "I get to go to the doctor today. I have healthcare. I get to go to the doctor today." Instead of saying, "I have to go to the gym," you say, "I can afford a gym membership. So the best I can do is show up and get in a half hour on the treadmill." Like just shifting it from "I have to do this" to "I get to do this. I have to go back to work on Monday. Oh, what a drag. I get to go back to work and I get to work on this project I'm really passionate about." And I think that that kind of just shifts the mindset into gratitude. And that's something that really helped me when I was going through a little bit of a tough time, and I was like doing school and trying to get a little bit healthier, and kind of a family dynamic that was tricky. And then work was intense on top of that. And I was like, okay, I'm just going to look for like little tricks. And that made a huge difference. And I still do it to this day. Anytime I'm like, oh, I have to do this, just switch it out to say, I get to do this. And then if you really don't feel like you get to do it, maybe it's something you shouldn't be doing.
Exactly. And to have flexibility, and if we take a typical example of like exercise, well, maybe 4 days doesn't make sense for you. Maybe one day is great, and that's fantastic. And there are ways of celebrating that. Any small change towards a behavior that you are trying to achieve, or a mindset, or way of thinking, is success, right? We don't need to be so hard on ourselves. We need to have more compassion towards ourselves and our challenges. And, when you think about the brain and connections that we make, it, think about it like a muscle. Whatever you're going to use more is going to be easier to access. So if it's negativity and you're used to criticizing things and people and whatever, that's going to be easiest for you. If it's gratitude, that's what you're strengthening and is going to be easiest for you. If it's optimism, those are the connections, right? You're making, and so we can train ourselves that way to be happy. And it's not toxic positivity, because I don't believe in that at all, and I do not support anything like that. But there are ways for us to alter our mindsets like that, to look at, exactly that, what we're grateful for, what's working well in a challenge, what can be an opportunity, what we're happy about, what are the small wins. They're there. The fact that we wake up every morning and that we're alive, we take things like that for granted, right?
I also think that something that comes up a lot at this time of year, at least for myself, but I'm sure I've seen it amongst my network and my friends and stuff, is that it kind of makes that all or nothing trap really easy to fall into, where you're like, okay, starting Jan 1, I am not drinking alcohol, I'm not eating gluten, and I'm going to the gym 3 times a week. And then if you don't do one of those things, or if you falter, you cheat, it's like, "Never mind, you know what? I'm gonna throw it away. I'm just gonna sit on the couch and watch The Simpsons for the rest of the," like, and so how do you tackle that all or nothing thinking that kind of we fall into at this time of
I
year?
think it's exactly like we were saying. It's identifying one or two, maybe three, whatever feels right for you. It might be one small behavior change, or one small attitude or sort of mindset. It could be a behavior, a mindset, something, a way that you speak to yourself, that you speak to others, but it can be one or two or three, whatever feels right that you can achieve. That's the most important thing, is finding one small change that's actually achievable, so that it motivates you, and so that you have that small win and that success, and then you build on it. You say, "Oh, I went for a walk 3 times this week. Amazing. Okay, maybe next time I'll go to the gym 1 day a week or something." And then I try that, and then if it doesn't work, I say I can observe it with curiosity to say, "Oh, well, that didn't work. Let me think of, what the challenge was and what I've learned from that, and then what I can do." So we're getting out of a mindset of like criticism, and then just throwing in the towel and trying to figure out like, well, what's right for me? What worked? Where was the success? And then being happy about having that success, right? And that win, rather than just harshness. Well, I didn't go 3 days a week and I ate bread. You know what? Like at the end of the day, when you're looking back on your life, are you going to care that you ate bread or not? I don't know. I won't. But like, so what's right for you? Figure out like what makes sense and what's meaningful for you. I want to eat bread. I want to eat pasta. I'm happy about that. I'm not saying that, that's applicable for everybody, but to find the behaviors and mindsets and changes that feel good, right? Because we have one life.
Yeah, and I think the balance is so key too. Like if you're saying rather than saying like I'm going to cut this out or I'm going to stop doing this, I'm going to be more mindful. You get that all or nothing thinking where you're like, well, I went for pasta last night, so now I might as well just but it's like, no, just then for breakfast the next day, just don't have a bagel. Like just give your body a break and, work that muscle, build that pathway. You don't have to throw out the baby with the bathwater or
Exactly. Any behavior change, like if people are, I mean, I don't know, trying to drink less, let's say, and then you drank more than you wanted to or more often, it's not a failure, right? It's looking at like, okay, well, that night didn't work the way I wanted. What can I do? What can I do differently tomorrow or whatever it is, or next weekend or something? What does that look like? Or today? What are those small kind of behavior changes and shifts? And then, like you're saying, to be mindful of that, okay, well, I had a bagel, so maybe I'm gonna not have bread at lunch or something to try to balance that. Uh, and there's an interesting study that you're making me think of. It was about people on diets and people dieting. If they have one cookie, they were more likely to just kind of eat the whole box or like eat a whole lot of cookies. Whereas people who don't put those limits and aren't dieting will eat one cookie and maybe they'll have a second one. And like that's the end of that, right? So when we become overly restrictive or controlling with ourselves, we often create the opposite effect. Like if I say to try not to think of a pink elephant, like, good luck. Good luck. So it's like sometimes that's it. The more like restrictive and controlling we try to get with a certain behavior or way of being ends up having almost the opposite effect on us, right? So I think we need to be kind, we need to have compassion towards ourselves, we have to work with ourselves and see what makes the most sense. And it might not be that ideal of 5 days a week and whatever else of exercise and no bread or whatever.
so with your time with dialogue, do you have like a favorite client story or a client that's doing a really great job offering their employees these great benefits?
I mean, I think there are so many. A pattern that I've seen that is really fantastic is when we see that they have multiple services with us, like let's say they have primary care for physical health and they have EAP and they use wellness and we have mental health plus, which is longer term psychotherapy coupled with medical support. So what we see is the users or our clients that have multiple services and where utilization is higher. So the more they are using, the greater the benefits are. That's when we're seeing changes related to like employee engagement and retention and greater ROI. So services are only as good as they're used, really, right? So we have to think about how to increase utilization, how to meet people where they are, and then how to get them to use the services that they have. Because then we know the whole system works better together and we start to see those really great benefits. And so I'm thinking of one in particular that they had published an article around this. It's a company in Quebec and when they implemented Mental Health Plus, which is the longer term psychotherapy coupled with medical support, when you have a mental health problem, you also have access to a doctor and an entire team. So that way it's less disjointed. It's not, okay, I went to a walk-in clinic and got a note and then I went off work, but I had no psychotherapy, no follow-up, there's no connection with the doctor and the therapist. And so people tend to stay off work longer. They don't get the help they need. So one company had implemented that and they compared the LOA duration before using the service and after, and then they reported on that, and they saw a significant decrease in LOA, the days people are on during a leave of absence. So not the amount of leaves of LOAs, but the duration, which is really significant and is absolutely related to the fact that everything is integrated and shared and there's exchanges and people are getting timely support rather than even waiting 2 weeks or a month of your leave, for psychotherapy, you're able to connect within 1 or 2 days to get, the support you need and get going on that. And so there's really nice stories like that where they publish results as well. So I love to see that because I always want to see how can we actually improve people's, for clients, for organizations, how do we improve the pain points that they have, the issues that they're experiencing, and then looking at the client, or what we call the members, so the people using the service, are they benefiting? What are their outcomes clinically? Are their symptoms improving? Are they more functional? Are they going back to work? Right. So I like to see the whole system and say, well, for the organization, their ROI, what are they getting back? How are things improving for them? The users of the service, what's happening for them? And then having that ability to sort of to look and redesign systems and services so that we can get the most out of them.
Hmm. Yeah, I think that's so important. It made me think, and this is going to be a little bit of a silly question, but can you tell me what the difference is between psychiatry, psychotherapy, and any other realms within the profession? I just realized that there's a lot of different professions that have similar names, but I don't actually know what the distinction is.
Yeah. It's not a silly question at all. I think the majority of people, unless you've been a user in these kinds of systems, you wouldn't necessarily know. And even if you have, you maybe wouldn't know because it's not entirely clear. It's not something people are overly familiar with. Okay, so when we talk about a psychiatrist, they're a medical doctor. So they went to medical school and then they specialized in psychiatry. It's like your dermatologist, but they specialized in mental health. So they mostly will prescribe. They will diagnose, and they will prescribe. Some of them do a bit of talk therapy and support, but realistically, because they're so needed for diagnosis and prescription, the majority of their time looks more like that. When we talk about a psychologist, so in Canada, everywhere with the exception actually of Alberta, but that might change, it's somebody who has a PhD, and so they've done a bachelor's, a master's, 4 years of a PhD, lots of clinical internships. So they have in-depth experience about, mental health, how to treat mental health. And so a psychologist legally can diagnose in most provinces in Canada and will provide psychotherapy. So intervention, they will use a type of treatment. It might be cognitive behavioral therapy. It might be like dialectical behavioral therapy or different or EMDR, or whatever kind of intervention they might be using. Eye movement and desensitization reprocessing therapy, like for trauma. So there's different approaches that a psychologist will use to provide psychotherapy. And psychotherapy really is looking at changing thoughts, emotions, and behaviors through interventions. And it's a protected act, which means you must be licensed. Versus, let's say, a counselor and counseling is different in that they're not diagnosing, they're not providing psychotherapy. So you're providing intervention, which could look like coaching, which could look like emotional support, resources, and so is a different type of approach. And depending on people's needs, right, you could consult with the professional that's best suited for you. Like if you have a cut, you need a band-aid and not stitches. So it's figuring out, like, based on people's needs, like what the right type of professional and intervention is for you. So yeah, so it's important for people to look into that too, to see like who is the professional, what is their background, what is it that I need. If you have insurance as well, like does your insurance cover it? What do they cover? So yeah, I think it's important for people to inform themselves to find like the right fit.
Are all of those types of practitioners available through dialogue?
So at Dialogue, we have medical doctors, we have nurse practitioners that are all licensed, we have psychologists, we have psychotherapists, we have counselors, we have psychoeducators, we have social workers. Also, those are two really big ones I didn't mention. But psychotherapists and social workers also will provide intervention in mental health. And psychotherapists are allowed to provide psychotherapy, they're licensed to do that. And social workers will provide more intervention around like supportive approaches and counseling, and often work within systems and families. And but then again, it also depends on their background. Like you might be social worker who's worked 15 years in in grief therapy. So you would be far more appropriate than somebody who, I don't know, is providing whatever kind of psychotherapy but has no experience in grief, you know? So I think it's very important to find the right fit for you as a person, who you connect with, and then look at the person's experience too to see how you can get the most help.
So how does intake look on dialogues? Like if I were to come on and I don't know anything about what I need, but I know I need help. Like what does that intake process look like?
Yeah, so we make it really easy. So you would go on in the app and you would say support for mental health or physical health. So you don't need to know what program you have. You don't need to know if you're in employee and family assistance program or mental health plus. You just click mental health or you click physical health. And then when you go into either of those flows, there's some questions that are asked. And so in mental health, we use mental health questionnaires that are validated to understand what people's symptoms are and severity. It's a quick assessment just to see what your symptoms are, and then to be able to match you to a service that would be most appropriate for you. So you don't really have to know what you're clicking into, just that it's mental health, and explain what you're experiencing and the need, and then if you want to talk to somebody or not. Because that'll always be an option. There's a lot of different providers that don't give you the option where it says like speak to someone now. They'll just give you like a self-guided option or resources or something. Dialogue will always give you the option to speak to someone, a mental health professional, always. If you don't want to, you don't have to. Like if you prefer to use ICBT, like internet-based cognitive behavioral therapy, or you want to go on in our wellness platform and, read articles or watch whatever kind of videos or content, work through things on your own, you can absolutely do that. But we would always give you the choice to speak to a person, a mental health professional or physical health, depending on what flow, what your need is.
Is that over Zoom call and or chat, or is there several different avenues for that?
Yeah, so it'll be either, so if you have the app or the web browser, whichever way you want to connect, you can have a video appointment, you can have a phone appointment. There's in-person services too. For in-person, you would have the call center. You would need to go in through the call center. So you can also choose to call. There's a traditional call center, and then you can set up appointments that way. You can still set them up virtually. You can still set them up by phone. You can set them up in person. So just depending on what people's needs are, and how they wanna meet. That's for mental health. For physical health, that is virtual. There we have some clients who have, physical clinics, which I think is really, interesting and amazing. They have their own walk-in clinics and services. For the rest, it would be virtual for physical health.
It sounds to me like I don't have any kids or anything, but it sounds like if I did, having dialogue as kind of a back pocket thing in the benefit plan would be really good because as your kids are growing up, you might start tackling things that you are so foreign to and you just want to make sure they're okay. I could picture people who have a growing family needing, they might not know they need it, but having it in their benefits package would be like so helpful.
The amount of times, parents with a kid or baby, or first time parents, or, others have issues in the middle of the night, need support with a kid who has a high fever. Do I go to the emergency? Do I not go to the emergency? I don't know. How do I figure that out? Is it worth, going there? Is it serious enough to go there? What do I need to do? Or there were so many, this is kind of, not a fancy topic, but like pinworm, kids who get pinworm in daycares, and how do I treat that and what do I do? And I don't know if it's in every province, but anyway, in Quebec now you can get the medication over the counter and you have to treat the whole family. So it's for these situations, and more serious ones where, yeah, you need like immediate support. And then if so, the majority of issues, a good amount, can be treated virtually. And for those that can't, when you need a physical exam, like let's say it's an ear infection, they need to look in your ear. You can't diagnose an ear infection without looking in an ear, right? That they'll explain to you what you need to do and why, and then where to go, like what clinic you can go to for a walk-in, how you can get an appointment. And then recently, when I, for example, consulted for my daughter who's 5, she was complaining that her throat was hurting and she was having trouble breathing, and I wasn't sure. So I called. Or I booked an appointment through Dialogue right away, and I had the appointment within like 45 minutes. And so the doctor explained like look for this. Is she feeling this way, whatever kind of symptoms, and and what to look for. And then he said, well, I'll give you the referral to go get like a strep test. And then if ever she has strep, I'll write the prescription for the antibiotics. So that way you're done. You don't have to go to the doctor, to the clinic, to whatever. You're good. And thankfully, she didn't have anything. But had she had something, I would have had the prescription on hand already. It would have been done. So it's like yeah, it's life, truly life saving.
Yeah, and I bet you there's probably an unseen impact because bringing a kid who has strep throat to a waiting room
Right.
is not
Yeah.
necessarily the best on our healthcare load either. So that's really interesting. It sounds like dialogue is something that is like we have dialogue on our benefit plan, as I mentioned earlier, and I've heard countless stories, especially the moms that I work with that say, yeah, like my kid was up at 4 a.m. and they were throwing up, and it turns out they ate this thing, and we weren't sure if they need to like go to the hospital. And so, yeah, it's great to have. And then I think as kids turn into teens too, having the mental health options and things like that, just at your fingertips, I think is so important.
Yeah, and I mean, and we hear countless stories too in adults where, they thought, well, okay, there's something happening with my breathing and my chest and whatever, and do I go to the emergency or not? And then it turns out the person's in like heart failure and would have died had they not called and gone to the emergency. Like they're very serious situations that the nurses, that the doctors are going to be able to detect by asking you certain questions and say, yes, go to the emergency. Or whatever they're experiencing, it turns out it was like a double pneumonia and they needed to be hospitalized, and had they not, yes, they could have died. So there are lots of very serious stories like that in adults, as well. Um and sometimes it depends also on the province, but sometimes it's so hard to figure out where to go and what to do, that dialogue will help you figure out, okay, where can you actually go and do this, where can you get this, what are my steps. And then you'll get a treatment plan always for physical health, for mental health after. It'll say like, okay, as discussed, we said like this, and this, and you can go to this place and this place and this place, and then we'll connect back with you to see how are you doing.
Yeah.
Did the resource help?
What's your advice for advisors to bring this to their clients and drive it home how useful and important this is to have in their benefit plan?
When I've spoken to brokers, advisors, what comes up all the time is the ROI, because budgets are so tight. So I think it's always about looking at the pain points in an organization, like trying to figure out what the issues are. Like, do they have a lot of short-term disability leaves, long-term disability leaves? What is the duration of their leaves of absence? Are the durations very long? Like, what are they struggling with? Are they struggling with engagement, retention? Can always, I think that's the best way to open the door to resources around, mental health, physical health, and then ROI. It's just really powerful. Like we have an ROI calculator for Mental Health Plus, for example, that we can play with when we know how many employees, the average salary, we know symptom improvement on average from our database, and we can get a sense of, well, what are you actually going to save from having that program? We have a similar calculator for EAP as well, for the Employee and Family Assistance Program. So I think ROI conversations are big in that space. People wanna know what they're saving, what they're getting back, like, so yeah, pain points and ROI.
I agree. I think that the tides are shifting a little bit in our industry where people are starting to say there could be an ROI on a robust benefits plan. It's not necessarily just an expense. If your employees are educated on how to use it and what's available to them, which I think is maybe the crux. I think a lot of times if employees don't know what's available to them and you're paying for it and they're not using it, then you've got a problem. But if there's so many ways to educate employees about what is available to them, and some things like dialogue are a no-brainer. Like anyone can use it for all kinds of things. And I know when I sign on to dialogue too, even if I've got nothing wrong necessarily, there's a whole bunch of proactive health stuff. There's like wellness things, there's workouts on there. There's all kinds of stuff that you can do. So that's really cool. I love what you guys are doing.
Yeah, thanks. Yeah, and I think, being able to support, right, in health in all ways, health and wellness is only gonna benefit people, organizations, like all of us, right? And I think for organizations, the point that I see as significant with clients, I'm not sure about like brokers advisor group, but maybe it's helpful when you have a partner that's going to help you work closely with you with the onboarding. That I've seen as being significant in terms of being a a decisional factor to say like, yes, let's make the change because there's going to be a team working really closely to help it get implemented, to help with registration, to help with utilization. Like we'll work closely to figure out what the right plan is. We'll work closely with organizations to figure out what that looks like. And I think that's so important because that's the best way to get the most out of the product. You want people to use it, like you're saying. So you want to work with an organization who's going to help you figure out how to get people to use it, right? And work on promotional campaigns and whatever else is needed to push that out so that people register and use it.
Yeah, yeah. I think that's really important. The education piece is probably the most important part. And to that end, if an employer is listening to this podcast and their advisors never introduced dialogue to them, but they want to bring dialogue to their advisor or they want to look into it directly to add to their benefit plan, where can they find the best information?
Oh, yeah, no, that's a great question. Online, you can connect with us. You can even browse a lot online, and then you could connect with one of our employees to give you information about different programs or whatever you want to learn more about. Sometimes we provide a trial as well, so people can kind of test it out and see it for themselves. So I think, yeah, starting with the website's probably the best approach.
Awesome. Thank you so much. My last question before we wrap up is just what is your biggest piece of advice for listeners, advisors, employers, or employees, or just anyone who's, out there? It's January. What's your biggest piece of advice as we move into this new year?
That's a really big question. I think is being kind and having compassion towards ourselves and others, and giving ourselves grace. We're not perfect, and we're fine not to be perfect. And so the best way to help yourself and find any kind of gains and moving forward is by being your own best friend and kind, showing kindness to yourself to figure out what it is that you need to improve, to move things forward, to be more optimistic, to make whatever life changes. The more we kind of force and restrict and try to control, the more difficult and reactive we're going to be because that's our nature. So making sure that we're able to treat ourselves like we would our best friend, our child, to take a step back and see if we're being harsh and unkind to ourselves.
Love that. I'm going to take that to heart. I think that's awesome. Thank you so much for talking with us today. And
Thank you.
thank you so much. Thanks again so much for listening today. If you'd like to learn more about what Dialogue does, you can go to dialogue.co. If you'd like to learn more about what we do at MyHSA, you can go to getmyhsa.com. And if you want to listen to our future episodes, you can check us out on any podcast platform. Thanks again. Happy New Year. All the best in 2026. And we'll see you next time.